you for the opportunity. So my presentation is about a paper that we did in 2021, a scoping review of national antimicrobial activities in 8 African countries and adaptable recommendations out of that. I'm doing the presentation as the technical consultant, in-country consultant for the Commonwealth Pharmacists Association. Next slide. So these are the authors of that paper. Pharmacists drawn from 8 African countries. From Kenya, we were 2. We have Nduta Kamere of EPN, Ecumenical Pharmaceutical Network. Others were from 8 African countries and others still from the Commonwealth Pharmacists Association. Next slide. So as Commonwealth, this is just a brief presentation, a brief update of Commonwealth. It has access to 1 million pharmacists globally, PSK being a subscriber to the association. And the vision is to lead and develop pharmacy profession across the Commonwealth. The strategic goals include developing the workforce through training and education, strengthening healthcare systems, and advocating for improved access and quality of medicines, and vaccines, as well as embedding pharmacists in different levels of medicines management. I think this is an important thing as a country when you talk about cancer. Next. So an overview of CwPAMS, it's a project that ran between 2018 to 2022. That was the first phase. Kenya was not included in that. We came in 2021, starting with scoping reviews like these ones. It's a project funded by UK Aid and the Fleming Fund. The management is two-pronged, so there is THET, which is the Tropical Health Education Trust, and Commonwealth Pharmacists Association. The aims of this project, is to strengthen national health workforce and institutions in lower middle income countries, creating opportunities in the 8 African countries, Kenya included, and through that lifespan, still ongoing, 26 projects have been done in the 8 African countries. And the second phase began this year, March, and will run all the way to 2025. Next. So a bit of a background of the project of this paper. We all know that antimicrobial resistance is inevitable in the long run because it's an evolutionary process. Microorganisms adapting and mutating to fight, to adapt and to survive antimicrobials. But the misuse and overuse of antimicrobials has made AMR a global focus issue. A challenge in sub-Saharan Africa is surveillance and regulation, which makes it hard to accurately define the baseline and effect sustainable solutions. The worsening trends in the sub-Saharan Africa are the burden of infectious disease, like TB, respiratory, and diarrhea. Next. So this study aimed at answering the following questions. What is the current status of AMR? What national policies and guidelines exist to support these programs? And what programs of antimicrobial stewardship and infection prevention control are currently in place for human and animal health? Next. The methods that we used, it was a desktop research, literature review using topics and keywords, local expert correspondence, and we have some members even in this conference who attended, who were consulted. Then the last one was a series of focus groups with participants during the months of April and May in 2021. Next. So this is an overview of what we did. We were 36 commenters and reviewers. Over 250 stakeholders were involved. 8 reports have come out alongside this scientific paper, which is already published. We also have an executive summary report out of that. 12 partnerships have been running in the 8 African countries, 8 focus groups, and then out of the 2,700 papers that were reviewed, 358 were used to come up with this report. In the course of that time, 21 One Health stakeholders were involved. Next. So these are some of the results that we found. You can see, and these are some of the things that we might have encountered in our practice: inappropriate use of antimicrobials in community and health setups, including as well vet treatment centers. Among the 8 African countries, only Kenya had specific antimicrobial stewardship guidelines for healthcare settings, and I believe some of you have been involved in coming up with those guidelines from the period of 2018, and I think finally they came out, they were published or signed off in 2020 in the middle of the COVID pandemic. At the hospital level, some of the challenges is lack of clarity of documentation of AMS, prolonged surgical antibiotic prophylaxis, you can look at all that, extensive use of antibiotics, and some of the problems here are using antibiotics as a preventive rather than a treatment kind of use, yeah? Lack of awareness among health workers. So these results eventually informed a call for expression of interest for healthcare facilities in Kenya to bid and get grant to implement some of these, to fill some of these gaps that were exposed. Under infection prevention and control, though there are guidelines nationally published for IPC, IPC appeared to be a neglected area at the healthcare facility level. We also have data scarcity, inaccurate patient records, and inadequate surveillance. So some of the adaptable solutions that were proposed, some bidding partners, they say they'll be doing point prevalence survey, and they got some of the funding, part of the funding because of that. There's poor hygiene compliance. These are some of the things that came up. Next. Continuation of the results. The current status of the implementation of the National Action Plan is not quite documented, and that includes the implementation status of the guidelines that we have. Then we also have all the issues of self-medication, what I mentioned, preventive use of antimicrobials vis-a-vis treatment, poor education of IPC and AMR, and the major issue of competing national priorities resulting to the AMS work being sidelined. We all know there's the issue of over-the-counter availability of antibiotics in the country. Next. So what are some of the adaptable solutions that we proposed that could work? So having antimicrobial stewardship programs and piloting them, yeah, conducting pre-service. This is something that MTAPS has been doing through PSK and other associations in the country, training people a series of antimicrobial stewardship, updating clinical guidelines to include the aware classification of antibiotics so that you don't have walk-in customers being given reserve antibiotics as a first line. Enforcing regulation, coming up with indicators for NAP, which is the National Action Plan, to monitor progress, incentivizing AMS programs, and further collaboration with IPC, WASH, TB, and health programs in all healthcare facilities. Kind of a harmonization, a harmonized kind of approach. Another adaptable solution that was found that could work is institutionalizing and decentralizing One Health activities, because vet also is an important aspect of combating antimicrobial resistance. Then we have strengthening and fostering partnership opportunities nationally and internationally, and this is where CwPAMS comes in to fill that gap in terms of funding and in terms of linking Kenyan partners with UK partners in a kind of capacity building and strengthening of systems. So at the footnote there, you can see the acknowledgements that of the names of people that were involved in the focus groups. We have Dr. Lois Ombajo, Dr. Alan Azegele of Directorate Vet Services, Dr. Collins Jaguga, who I have not seen in the conference, but he was heavily involved when he was at MTAPS. Christopher Kibiwot is an IPC nurse at KNH, Dr. Joseph Mukoko of MTAPS, Dr. Ndindakuso of MTAPS, Evelyn Wesangula, formerly FOCO AMR at Ministry of Health, who has now transitioned. So up to that point, that's the presentation as we did it. I would like to give an overview of some of the partnerships that got grants. Next slide, please. So we had 3 categories of grants: category A, B, C. Category A, it's for partnerships that had been previously funded. So this being a second funding, Kakamega County, together with Cambridge University, they were able to bid and get the category A of funding, which employed a hub and spoke approach. So they'll be supporting some of these hospitals mentioned here: Butere, Malava, Navakholo County Hospital, and also Masinde Muliro is part of the partnership. These ones got up to, I think, 15 million Kenya shillings to be able to do their initiatives. Then category B, we had Nanyuki Teaching and Referral Hospital, Dr. Panga, who I saw but may not be here now. Dr. Panga is there, thank you, Doc. They did a good proposal and got category B of funding up to, I think, 10 million Kenya shillings, depending on the fluctuation of the pound as well. And this is, I think, they are going to do some good work with the partnerships involved. They are partnering, the UK partner is University of Bristol and Weston, but we also have local partners, I think Lewa Conservancy and some hospitals in Laikipia. Then category C, roughly 1.5 million Kenya shillings, and to implement various projects within their hospitals. The next slide, please. So Kitale County Hospital, Kilifi County Referral. These are some of the partnership. These are the partnership that won category C partnership, which I think is a good thing. Maybe there are some hospitals that tried to bid and were not able to get a UK partner because that's a mandatory requirement. This is a time to network and have partnerships that we can leverage on, because the Fleming Fund is here to stay, and it will be open for applications sooner rather than later, so it's good to be ready. I have one more thing to do. Please allow me to call Dr. Iwak, who had one extra adaptable solution for combating antimicrobial resistance. Just 1 minute, sorry.
I'll be very brief. If we can move to the next slide. So this is a project still under the Commonwealth Pharmacists Association. It's an application. In short, it summarizes PAC, surveillance and prescribing support for antimicrobial stewardship resource capacity building. Moving on. So this is an app that is supposed to, this project has developed an app that is supposed to be able to facilitate being able to access your, the national AMS guidelines, as well as if you have institutional-based guidelines. So we move next. It's supposed to support point of care access to information. So that is how you can be able to log on to the app. There are 13 countries which have put their, who are to work on putting their apps online so that it is easy for you to be able to get to them. And even for the teams that are developing their guidelines, it is easy to be able to revise them. So I think that was the last slide. Yes. So once the Ministry of Health has finished the updating and can release the guidelines, you'll be able to access the Kenyan guidelines on that app. Thank you.